Dr. Richard Harvey is joining us from the UNM Cancer Center to talk about a major development in the fight against childhood leukemia. Thanks for being here.
Thank you.
There was a big discovery researchers have made. Explain what it is and how it affects fighting this disease.
What we've identified is a particular gene, a kinase called JAK, J-A-K, and the JAK kinase has a mutation in a certain number of children with high-risk leukemia. And these children don't respond to any other therapy. Their outcome otherwise is very, very poor. The discovery of this particular mutation is a lead to a potential therapy that will really benefit these kids.
So from what you're seeing, is this what causes the leukemia in the select group of kids?
It's likely in combination with other things. Whether it's the first event or one of the others, cancer is essentially an evolution of problems that you get multiple hits. This is one of them. Whether it's the founding problem or whether it's one of the subsequent, it's absolutely playing a critical role, and targeting pathways in which JAK is present are likely to be very effective as therapies.
How does this change the treatment with the therapies? I mean, you know, we talk about the different ways kids are treated and how this steers things a little bit.
Currently, high-risk leukemias are treated about the same. And what you're hoping for is something to focus on just the bad genes, but just the bad cells and not all the cells. So when you give a leukemia a chemotherapy agent, you're killing all the cells. Here we'd have a specific therapy that would be targeting just those particular cells that have this disorder. In chronic myelogenous leukemia and adult leukemia predominantly, there's a drug that does exactly this, called Gleevec. It focuses on a kinase, a similar type of gene, and that's been incredibly helpful and enormous benefits.
So you had said this is one of the most aggressive, so a lot of these kids, I'd imagine the success rate, this will really help the success rate, hopefully.
In the particular group we saw, if children have this mutation, the survival at 5 years is basically zero. That what we're seeing is kids having essentially no chance if they're given conventional therapies, you're now able potentially to cure them. At least you focus on something that appears to be causative, and you have a drug that is being in clinical trials right now that might be effective.
We're talking, though, too, about a select group of kids. I mean, we're not talking across the board. This is...
They are children from all over the country, but acute lymphocytic leukemia, ALL, affects probably 3,000 children every year. And this is a subset of the worst of them. So we're only talking a couple hundred kids probably per year, but it is a chance at a cure. And otherwise, these children haven't responded to anything so far. That's the difference.
You had said you had gotten a hint about this about 2 years ago. It took that long to develop. How long until you think they can really start targeting this in the therapy and things like that?
Unlike a lot of cancers, this one has a drug that's on the shelf. There are drugs in trial now that are JAK inhibitors. They're being explored by drug companies for other diseases. Our hope is they could immediately be applied to these children, and we might be able to put them in clinical trials very, very rapidly. The focus now is to be able to identify children with this exact deletion, with this mutation, and not just not guess. We want to know which children have this mutation, and then we'll focus just on them. So we now need a diagnostic test.
You're working on that, obviously.
We have one.
Okay. Oh, good. Well, thank you very much for joining us. We appreciate it. Always good news from the UNM Cancer Center.
Thank you.